As developing and poorer countries continue to struggle to get vaccines, Western countries have been asked to stop stockpiling of COVID-19 vaccines. Former British Prime Minister Gordon Brown, who is a United Nations Special Envoy, has accused rich countries of committing a moral outrage by stockpiling COVID-19 doses while poor countries are struggling to get supplies. Western countries are hoarding nearly 300 million shots, while only 70 million people in Africa have so far been vaccinated. Let's have this conversation with the Chief Narrative Officer at Clio's Advisory in London, Ted George. Hello, Ted. Good to see you. Good afternoon.
It's good to be back.
So tell me, how badly would you say it's been with West Africa with COVID-19? How badly has West Africa been affected by COVID-19 compared with other regions of the world?
Well, in fact, Africa has done relatively well. There have been three different peaks. There was one in July last year, there was earlier this year in January, and just recently over the summer. But the reality is that we're looking at around 40,000 cases a day, and even at the peak, around 1,000 deaths a day. That's the same as we saw in the UK during the peak. That's the UK versus Africa. So on a global level, actually, it hasn't hit Africa as badly. And probably we're looking at around 4% of deaths in the world, even though Africa is around 16% of the population. So clearly there is some resilience in, and particularly West Africa as well, for COVID up to this point.
Now, vaccines rates are low, but how serious an issue is this for West Africa in infectious rates and deaths are not low?
Well, I think this is the interesting thing, is it appears that Africa has really managed to get through COVID quite well. I mean, it has been hit economically, obviously, trade, business, severely disrupted, and travel as well. But West Africa has the experience of Ebola, which, it knows now how to handle pandemics. There is much more of an outdoor culture. A lot of people spend time in the outdoor in the sun, which is much better for reducing transmission. And there might be some genetic component here as well. But the reality is that COVID has not been as lethal as in the Americas or Europe and Asia, and therefore it is not the same kind of health crisis it's caused, at least to date.
Now, Gordon Brown recently accused Western governments of stockpiling vaccines and charged them to ship vaccines to developing countries. How do you view Mr. Brown's statements?
Well, the thing is, I mean, it is a fair accusation because there are 300 million now vaccines. There may be 1 billion stockpiled by the end of the year. And that's even taking into account the booster shots that they plan in Western Europe. I think the problem is it's a lot about distribution and logistics. A lot of these vaccines, particularly the Pfizer, they have to be stored at very low temperatures. You need actual special equipment for this as well. Other vaccines like AstraZeneca, so much uncertainty is being spread over them for different reasons around the world that there are people who don't want them to be imported. So it is complex. But if you look at COVAX, which has these commitments of 4.5 billion vaccines for the world, they plan to distribute 1.2 next year. So there is a real move on this front. But I think it's a very fair question to say that vaccination has just really not been at the rate in the developing world that it has been in Western markets.
Now, when is West Africa likely to get enough vaccines to start large-scale vaccination of its population?
Well, this is a big question because I think the real thing that has been the experience where the COVID has hit really badly in other markets is the necessity as soon as possible to vaccinate the most vulnerable. So people of a certain age, people with certain health conditions. That's probably one of the most important things. So it is quite possible that quickly, provided these people can be identified and the vaccine can be got to them, they could be vaccinated. Because the vast majority of Africa's population is very young. A lot of it is, in fact, under the age of 16 or 18 and probably not at risk to the virus. But there's always variance. So the fact is, I think there's a good chance that any potential damage variants could be reduced if the vulnerable are vaccinated relatively quickly in the next 6 months.
Now tell me, how serious a threat do the new variants of the disease in West Africa, and what impact do you think it could have on the region?
Well, this is the big unknown. I mean, there's already been a Nigerian variant, which is very similar to other variants around the world. But the fact is, as we've seen with the Delta, it's starting now to attack more younger people. It's proving much more easy to transmit as well. It changes the whole time. So just to assume that it's going to continue being not as difficult in Africa is not the good assumption. But I think there is already ingrained in the way the people work and the governments work in West Africa a knowledge of how you deal with pandemics. And there's a very strong sense of society society and social support, certainly in a lot of the communities across Africa. So I think that certainly West Africa is well positioned to deal with this, but I don't think there should be any complacency, because a really serious variant could set everyone back to square one.
Well, from the look of things, it seems COVID has come to stay with us. So it's just for countries to find a way to deal with it. Thank you very much, Ted. As always, we do appreciate your time.
My pleasure.